Hi, I'm Rob Holtz, and I'm pleased to be presenting on behalf of the Health and Safety Working Group of the King School Reopening Task Force. So the Health and Safety Working Group is focused on COVID mitigation measures and quarantine protocols, and it's composed of a mixed group of staffalty and trustees, Nina Newman and Sandy Lazare-Duff, as well as 5 trustees, myself, Jess Demo, Greg Jansen, Todd Raker, and Matt Allard. For those of you who don't know me, I'm a King parent and trustee. This is my family's 19th year at the school. My 3 sons are all King lifers who started in pre-K. Tyler and Alex are graduates, and Jack is a junior. My wife, Mary, and I have been active volunteers at the school for over 18 years in numerous PA and board roles. I want to preface this by saying I'm not a medical professional, nor do I have a science background, but I did spend much of my professional career synthesizing research, data, expert advice, and risk-benefit analysis into actionable plans. So as the whole reopening task force was working on the upper school, we were asking ourselves, what is the gating factor to getting the King Upper School students back in person 4 to 5 days a week? And basically it came down is the main constraint to that is the 6-foot social distancing requirement. And that's just due to the physical plant we have, the space we have, the classrooms we have, which then causes us to take a step back and ask ourselves, what is the science and research behind the 6-foot standard? So first places we ended up focusing on was the American Academy of Pediatrics. They are a trade group that represents 67,000 pediatricians nationwide with a stated mission to attain optimal physical, mental, social health, and well-being for all infants, children, adolescents, and young adults. And they issued guidance for school reentry back in August. And a couple of key points came out of that. First thing is they noted the importance of in-school instruction, not just for academic achievement, but also for student social and emotional development. They also cited the significant differential impact remote instruction has had on students from different racial and ethnic groups and vulnerable populations, and keyed in on a lot of the inequities in remote learning. And then finally, and most importantly for this discussion, they acknowledged there's a conflict between optimal academic and social emotional learning in schools and strict adherence to the 6-foot social distancing standards. And they explicitly say that schools should weigh the benefits of strict adherence to a 6-foot spacing rule between students with the potential downside if remote learning is the alternative. They note that some countries have been able to successfully reopen schools after first controlling community-wide spread of COVID while using 3 feet of distance between students without increases in community spread. And then they also note that research has found that spacing desks at least 3 feet apart and avoiding close contact may have similar benefits to 6-foot spacing, especially if students wear cloth face coverings and not have symptoms of illness. At the same time, they do note that teachers and staff should stay 6 feet apart from other adults and students when possible. A lot of the science, and certainly the American Academy of Pediatrics, has revolved around this highly cited study by the COVID-19 Systematic Urgent Review Group effort. It was published in The Lancet in June 2020. And The Lancet is one of the leading medical journals in the world, probably second just behind the New England Journal of Medicine. And this particular study was actually a meta-analysis of over 170 independent studies of transmission of COVID and related diseases, things like SARS and MERS. And what the Systematic Urgent Review Group found is that transmission of viruses was lower with physical distancing of 1 meter or more. And from a policy and public health perspective, current policies of at least 1 meter physical distancing seem to be strongly associated with a large protective effect. And there are further protective effect the further distancing out you go. We then sort of looked at the public health guidance. I think we're all familiar with the U.S. Centers for Disease Control and their general guidance that says people should stay at least 6 feet from other people. But again, if you look deeper into their guidance for school reopenings, they say that seating and desks should be 6 feet apart when feasible. And actually, the US CDC is an outlier globally on distancing guidance. The World Health Organization recommends 1 meter distancing. And most of Europe and Asia have coalesced around 1 meter distancing, usually in addition to mask wearing. The other thing that we're constantly looking at and keeping apprised of are community COVID conditions. And we're very lucky to be located in Connecticut and Fairfield County, where transmission rates remain very low. We're seeing test positivity of somewhere down around 1.5%, which, while a slight tick up from the lows of a month or so ago, are significantly lower than the 30-40% numbers that we were seeing back in the spring. We don't believe there's been a single case of in-school COVID transmission in the state of Connecticut. And we're aware that a number of other schools in Fairchester have been operating at 3 to 4 foot distancing with no in-school outbreaks. St. Luke's, Darien Public, New Canaan Public, and the Greenwich elementary and middle schools are all operating at those distance levels. And then finally, we also note that Connecticut successfully moved to their phase 3 reopening on October 8th. We also decided to go and get some outside expert medical advice. And we were very lucky to be connected to Dr. Asha Shah, who's advising us now on COVID and related health and safety measures. Dr. Shah is the Associate Director of Infectious Diseases at Stanford Hospital. She got her fellowship in infectious diseases at Columbia Presbyterian, as well as a master's degree in epidemiology from Columbia. She had some in-the-trench experience caring for hundreds of COVID patients at Stanford Hospital last spring. She's a lifelong Fairfield County resident with 3 kids in the Darien Public Schools, and she's worked with a number of other local private and public schools on their reopening plans, including Darien and Stanford Public and St. Luke's. It brings us up to our plan. The Health and Safety Group, together with the other members of the reopening task force, are comfortable that we can get all of the upper school kids back on campus full time. To do that, all faculty will still be maintaining 6 foot social distancing between adults and between the faculty and the students. Students will be maintaining 6 foot distancing during lunch, mass breaks, and their frees. And inside the classroom, we'll use 6 foot distancing where it's feasible and 4 to 6 foot distancing where it isn't. While we're doing this, we're going to keep all of our other mitigation measures in effect. Masks will be required at all times, except while eating lunch or on designated mass breaks. Worth noting and reminding people that King spent over $200,000 this summer upgrading our ventilation systems in the lower school, middle school, upper school, and PAC to maximize airflow, upgrade HEPA efficiency MERV 13 filters, and install a plasma bipolar ionization cleaning system. And the BNPI system is proven to kill 90% or more of COVID and other pathogens like Legionnaire's disease and E. coli and the norovirus. In the Italian Center, where obviously we couldn't do wholesale air system changes, we have installed Medify HEPA air purifiers in each room there. And on top of that, we're going to continue with our hand sanitizing and washing, daily symptom screening, building cleaning, and hallway traffic controls. Based on the totality of all of our mitigation measures, we believe the safety of our students and faculty will not be materially negatively impacted by reducing student distancing to 4 feet where necessary. We will be continually assessing community COVID transmission levels, and we'll be prepared to switch back to 6-foot student distancing hybrid learning, or even full remote if it's warranted. And this plan will allow the lower school and middle school to stay at 6-foot student distancing and should require minimal disruption to their program. When we focus on the risks, the key risk we see in shorter distancing relates to quarantine. So if we have a positive case in the classroom, contact tracing will be conducted, and anyone that's within 6 feet of a positive case for more than 15 minutes, whether or not they're masked, will be deemed to have been exposed. And anyone exposed will need to quarantine for 14 days. So at 6-foot distancing, theoretically, no one would be exposed to the positive case, so no additional quarantining would be necessary. But at 4-foot distancing, you draw a 6-foot radius around the positive case, and anyone in the circle will need to quarantine, which, depending on the layout of the room and where the infected case was sitting, that could mean 2 to 8 kids will have to quarantine. And that would be for each class the positive case is in. And obviously, if you game it out, if we have multiple simultaneous cases, we could end up with a large number of students having to be quarantined. In summary, the school and board leadership believe that the modestly increased risks of going to a 4-foot minimum student distancing in the upper school at this time are significantly outweighed by the benefits of more days in school to the students, which will be very helpful for their both educational and social emotional well-being, and as well for the faculty, in that it'll provide for the elimination of teaching duplicative classes and also the work involved with preparing separate asynchronous lessons. To that, I think we'd like to turn it over to Dr. Shah to see if she has anything she'd like to add, as well as to open up the floor to any questions related to health and safety. Thank you very much.